Into conversation about diabetes, and I have a guest joining me in the studio to have this conversation. I have a doctor. Dr. Wala Aleruchi is here of the Department of Family Medicine, UPTH. Good afternoon, Doc.
Good afternoon.
Good to have you here in the studio.
Yes, I'm excited to be here.
Okay, nice one. All right, so World Diabetes Day. I'd like for us to begin from the general before we come down to specifics. General would be the day today, World Diabetes Day. Why do you think that it's important for there to be a day set aside to talk about or create awareness on diabetes?
All right, thank you for having me here. So, diabetes mellitus is a chronic disease, and it has a global burden. Okay. So it's not just River State or Nigeria or Africa. Like almost all the continents are battling with this disease, and that's why a day has been set aside to increase the awareness of this disease, tell the populace about this condition. You know, some people still think that it doesn't exist. It actually exists. People are suffering from this disease condition, and so this November 14th is the day that the World Health Organization together with the International Diabetes Federation put together to increase the awareness of this disease. And they chose November 14th because one of our fathers, which is Sir Banting, the person who produced or who talked about insulin, that was his birthday, and they decided to use this November 14th to mark the World Diabetes Day, and that's why we're celebrating it today.
All right, so let's get down to specifics. Diabetes. Someone probably is wondering, yes, I've heard about diabetes, but what is it like? What is diabetes? Do we have like different types of diabetes? If you just tell us about it, what the disease is all about.
All right, before I talk about that, I want to also let everyone know that for every year we have different themes.
Oh, okay.
And then for this year, we're talking about diabetes and the well-being. Beyond controlling the blood sugar, we're talking about the whole person, not just controlling blood sugar, talking about their mental states, talking about how they feel, talking about the stress they go through, the burnout they suffer at intervals, and that is what we are talking about today. So when it comes to diabetes mellitus, I had earlier mentioned that it's a chronic disease, and it meant when we say chronic disease, it means that this is a disease that you would actually, people who live with it will manage it almost for life. Like they live with it, and so all we do is to make sure that it is being managed effectively. And now diabetes mellitus is a condition in which the body has lost its ability to control blood sugar, and then this is as a result of either there's a particular let's call it a hormone or a chemical that the body produces, which we call insulin, and its responsibility or its function in the body is actually to control blood sugar. But for some reasons, either the insulin is actually absent, or the insulin is there but it's not effective enough, it's not doing its function. Either of these ways, a person can come down with diabetes mellitus, and there are two types: type 1 and type 2. Type 1 is a condition in which the insulin is actually absent for some reasons. We call it autoimmune. So the body fights itself, destroying the organ that produces that insulin. We call it autoimmune. So you find this more in children. So some people don't believe that children can actually have diabetes mellitus. Yes, we have some children we are managing that are living with type 1 diabetes mellitus.
Type 1?
Yes, ma'am. So this is because the insulin is absent. And then in type 2, there's insulin, but the body is not, it lacks sensitivity. The body is not, it's the insulin that is there is not like doing its function. And that's what we call the type 2 diabetes mellitus. There are other types. We have the ones that can come up even in pregnancy, which we call gestational diabetes mellitus. We even have pre-diabetes and many other types.
Okay, so let's look at, you said we have pre-diabetes.
Yes.
How is that? How does that happen?
Okay, so in medicine, when we say pre, that's before. Okay,
so that's like before diabetes.
Yes. Okay. So usually I tell people that it's like your it's a borderline. Your blood sugar is not normal, It's not within the normal range, yet it is not in the diabetic range. So you're like sitting on a fence. So it means at that point you need to make conscious efforts to ensure that your blood sugar level returns to its normal level, because anything you do or do not do can tilt you into any of the sides.
Either ways.
Yes. So that is pre-diabetes.
Okay, and then the gestational diabetes.
Yes. Gestational diabetes occurs in pregnancy, and then it happens that during pregnancy the blood sugar levels, of course, there are some
about the mother and the child, or just the mother?
Okay, so it happens in the mother.
Okay.
It happens in the mother, but the glucose can actually transport to the fetus, and so the fetus has some conditions that they are at risk of. So during pregnancy, the blood sugar levels go up, and the body is not able to regulate it appropriately, and then the such people. Don't forget that some people actually can live with diabetes mellitus and get pregnant. This person is a lady who is already living with, let's say, type 2 diabetes mellitus, and she gets pregnant. We also have another area where these people do not have any diabetes mellitus, but during pregnancy we notice that their blood sugar levels are not well controlled. Either of these pathways, together with the gynecologist, they are being managed. They give them insulin, they do some checks to ensure that the fetus is not affected by these very high glucose levels.
Okay, so that's for gestational diabetes.
Yes.
All right, so are there some predisposing factors? Are there things that would make one be prone to come down with diabetes? Risk factors? Yes.
So there are risk factors, and we try to classify them into what we call modifiable and non-modifiable. I will explain that.
Okay.
And it simply means that there are, like for example, non-modifiable. These are risk factors that you really cannot change. You can't change to a large extent. For example, if a lady, her mom or dad had lived with diabetes mellitus, it means that she is at an increased risk of coming down with diabetes mellitus. You're already born to that family, so you can't change your.
Inherited.
Yes, so we call it a family predisposition. That's a genetic component. In quotes, let me use the balance. It runs in the family, something like that.
Okay.
Yes, so this is a genetic component. You can't change your lineage, as it were, even if you do all the physical changes. You can't really change your genetics, as it were. So that alone can put one at an increased risk of coming down with this chronic condition. And then other things about modifiable, these are things that are related to lifestyle, especially when we're talking about type 2 diabetes mellitus, where as a result of what you do or do not do, for example, living overweight or obesity, it can put one at a risk of coming down with this chronic
diabetes
condition. Yes. Other things include living a sedentary lifestyle. You're not physically active. Alcohol and smoking has also been implicated in one of the risk factors of this condition. And then poor stress management. Stress has a way of releasing cortisol that can increase your blood sugar levels, your blood pressure levels, and if one does not actually control his or her stress levels, you can actually be putting yourself at a risk of coming down with this condition. And then poor sleep. Motivational speakers will tell you that sleep is for the you know how they say it.
Yeah, and then the rich people, so they can sleep.
It's said that poor sleep has been linked to some chronic conditions, including diabetes mellitus. It means that if you are not having a restorative sleep, as quality sleep, not the one that you sleep and wake up and you're already feeling tired from when you just woke up. We're talking about restorative sleep. Sleep rejuvenates. Sleep repairs body cells, but many of us do not have that information, and so we try to reduce our sleep time to achieve other goals and targets that we have set. But poor sleep has been implicated, and these are some of the risk factors. Some other things include infections. This insulin is produced by an organ in the body we call pancreas, and if that organ is infected, it can put you at a risk of coming down with this. And also some medications have been implicated to increase or affect the body's ability to control regulate blood sugar levels.
All right. So how does one know that they have diabetes?
All right.
Are there some signs and symptoms that your body would give to you that you just know that, or you just have to visit the hospital to check up to be able to know that you have diabetes?
Okay. So when it comes to, yes, there are some symptoms, but these symptoms are not really specific for diabetes mellitus. So the common symptoms people may experience is that they may be losing weight, unexplained weight loss. Sometimes they may be increased thirsts, increased hunger, and then increased urination in frequency. And then some, even in females, at least I had managed a lady who, she came in with just florid candidiasis, that's vaginal discharge that was so much, and when we tested her blood sugar level, it was actually high. So that was what brought her, but we checked her blood sugar. So some people can also present with florid vaginal discharge. Sometimes too, they can complain poor vision. Like, I have issues with my vision. They will just maybe go to the eye clinic, and then they check the blood sugar, it's actually high. Some other people can also complain of they have recurrent balls, or they just have this very simple wound that the normal person should resolve, but theirs is taking a longer time. So these are pointers to that we could, when we see this in some patients, we can say, okay, could there be an underlying diabetes mellitus, and then we go ahead and check the blood sugar levels. Then with that, we can now say, okay, yes, we've made a diagnosis of diabetes mellitus. So these are some of the symptoms that
but ultimately it would fall on the lap of the doctor or the medical personnel to be able to say that this person has come down with diabetes, right?
Okay, so from when you come to the hospital, we ask some questions. Some people get tired of answering the questions, but there's a reason we ask any of those questions. So from the what we call history taking, from asking questions, there's something our mind is pointing at, and then we are suspecting, because this person may have typical symptoms of this condition. We are suspecting.
So if you as a medical person is suspecting, that means there's no way the patient can know that I have diabetes, right?
It's unlikely, no.
Okay.
But once you have any of these symptoms, in fact, generally, when you're ill, you need to present to the hospital.
Right.
Because, like I said, these symptoms are not specific for diabetes mellitus. I can give you several other reasons for increased urination, even weight loss. I can give you more conditions that can even cause weight loss. Okay? So, but when you notice you're ill, or you notice any of these symptoms I have talked about, go see your doctor.
Okay, you mentioned urine, and I don't know if this is true, that some people say when you urinate and then you have ants gather your urine. It just Okay, so I was going to say this for later when we're talking about myths, but you mentioned urine, frequent urination, and then I just got to put that out there. Is that a thing?
We can't say for sure until we do some laboratory investigations, take history. That's when we can confirm that that person actually has that. What if you just urinated and you didn't know your neighbor poured sugar around that area, and then you see ants going there? These are some form of myths.
Okay, well, I'll just delay that and then get back to the myths towards the end of the show. But is this condition something that can be cured? Is it something that is curable, or if one has it, the person has it for life, just to manage?
Okay, so I don't want to use the word cure, because in the local man, when he thinks of cure, let me go backwards.
Okay.
Some people, when normally, for example, if someone has malaria and then he has all those typical symptoms, and then your health provider gives you anti-malaria and you start taking it as prescribed, in 3 days you actually, in fact, from the first day, the doctor has told you, make sure you finish this medication. In fact, from the first day you're already feeling better, right? In that case, we'll say, okay, yes, there's a cure, it has been treated, and you're fine, you're free, right? But in chronic conditions, we keep managing it. It's not like there is a cure in the real sense of the word cure, but our aim is to manage holistically the person, and which is still in relation to our theme for this year, diabetes and the well-being. So we manage.
Okay, I thought I saw something else. Bridging the gap.
Yes,
something.
bridging the gap. Yes.
Okay. All right.
So the management is holistic. We're taking care of especially in terms of diabetes mellitus, which is our topic for today. We are managing the blood sugar levels. We are checking their eyes. We're watching out for their diet. We talk about foot care, which is very important. Even because diabetes can have
foot care.
Yes, very important.
Why is that important?
Okay, I'll get there. So we'll talk about even skin because diabetes can have some skin manifestations too. So this is holistic care. Even the mind. You know, some of them have to be not one of the things we do in monitoring these patients is that they check their blood sugar ideally every day, but for some reason some of them do maybe alternate daily and all that, and they have to pierce themselves. That it's even the normal man that is not ill, piercing yourself is actually painful, and these people have to do it, in fact, almost every day of their life. So it has a way of affecting their whole psyche. Like, it's kind of depressing. So these are all the things we do to manage holistically, not like cure.
Okay.
In the real sense. And so we talked about foot care.
Yeah.
So in management of diabetes mellitus, foot care, I don't know, you've heard about amputations,
yes.
Leg ulcerations. So we'll talk about complications later, but one of the complications of diabetes mellitus is that it affects the nerves. In terms of, it causes some form of neuropathy. That's a big word. Just know that it affects the nerves. So you guys listening to me, if you pinch yourself now, assuming you do not have neuropathy, if you pinch yourself, you feel some pain, right? Some of these people living with diabetes mellitus have lost that ability. So they can so they can actually put their legs, like step on the nail, and they don't know. Some of them can actually, their leg would be in fire, and they don't know. The nerves that helps us feel, they have lost that ability. And so we educate them on foot care, from inspecting their legs every day. If they can't inspect, we teach them how to use mirror to inspect it, or people who live with them can help, because some of them can even have serious eye visual impairment that they can't even see. We tell them, inspect the legs. We teach them the kind of footwear
to wear.
They don't wear every other kind of footwear. There are specifics when it comes to footwear, because we do not want them to start having any wound, ulceration on their leg, because they already have issues with wound healing. And so we don't even want it to occur, because it can actually be a nightmare if it's not properly controlled, or if it's complicated with other things. That is when we now start talking of amputation, and it now looks like every diabetic patient will actually lose a limb. But these are risk factors, and then we need to make people living with diabetes mellitus, if you know anyone around you, maybe your mom, your dad, or anyone around you, teach them about their foot care. Very, very important.
Okay, so it's still talking about the management of diabetes, because you talked about holistic management.
Yes.
Do you collaborate with? You talked about the mind as well, because sometimes it can take a toll on the mind of the psyche of the patient. Do you do a collaboration with, let's say, mental health experts or psychologists or any other healthcare providers in doing this?
Yes. So when we talk of management, let me use our term, it's a multidisciplinary approach.
Okay.
That's more than one team, more than one specialty. It's actually managing this patient. So we have I'm a family physician. We are the first point of contact when they come into the hospital. We have the endocrinologists. We have the dietitians. We even have the podiatrists, this foot care I talked about. And yes, at intervals, the mental health physicians also see these people. And then we have the lifestyle medicine, who help these patients do some lifestyle changes to help manage this. So yes, it's a multidisciplinary team approach.
All right. Prevention. Is there a way, aside the case where it's hereditary, is there a way that this can be prevented?
All right. I'm sure you've heard of the typical
yeah. I mean, for some people, well, I just prevent all of these things. I mean, if I can prevent it, I don't have to, spend so much.
Yes. So even all these that I've said, prevention is key. In fact, statistics have shown that more and more people aged 20 to 79 will come down with diabetes mellitus by 2030. We are already in 2024. So there's a projection that more people, yes, it's an increase. So it means that everyone listening to us, hearing my voice, needs to be intentional about this. And then that is where prevention comes to play. And in the prevention, some of these things I would mention is both preventive and therapeutic. That's preventive for those who have not come down with this condition, and even those who are already living in this condition, they still need to adhere to this. And that boils down to what we call the lifestyle medicine. This is a branch of medicine that prevents, treats, and reverses chronic conditions, like if this diabetes mellitus we are talking about. And it has components, which I have mentioned some of them before. Now, these components ranging from diets, very important. We are talking about whole plant-based diets. We are talking of more veggies in our meals. There's something we call diabetic plate, but it's not specific for people living with diabetes. We call it the diabetic plate. Now, imagine our typical ceramic plate that is round. You divide it into two equal halves. Okay. Now, one of the halves should contain your veggies. That's the typical diet, whether or not you are living with this condition. So it's both preventive and for treatment. So that plate, half of it should be veggies. I know someone there is saying, you know how much vegetable is in the market now? Yes, they're expensive, but that someone will say, you are what you eat or do not eat. So we want our food to be our medicine, and our medicine our food. That is what we are aiming at. That is one way to prevent this diabetes mellitus that is posing a global health burden. And you listening to me, you have a role to play. And going back to that diabetic plate, half of it should be the veggies. The other half, you divide it again into two. That is assuming you were eating yam or rice. The other half, you divide into two. The quarter of it should be your yam or rice, and the other quarter should be your protein. That is the standard. Proper.
So that's diabetic plates.
Yes.
It's supposed to be for everyone.
Yes.
Not for people.
No.
Okay.
Whether or not you're living with the condition, that is what we want. We want you to eat more veggies. Here is why. Let me quickly explain. These veggies, these vegetables, when you eat them, they do not. There's something we call glycemic index. I won't bore you with that, but just know that when you eat, there's some foods you eat, the rate at which it increases the blood sugar is so rapid, is so quick, is so fast. But these veggies will not really do that way. And then it will fill you up.
Okay.
So it means you're eating less of the main, for example, rice or yam.
Okay. So is this where carbs come in? Because some people have said carbohydrates. That one is a no-no for when it comes to diabetes.
It's a no-no. Is it really sustainable? But if you work with these plates, it will really help. Because already half of what you're eating is already full of veggies, which will both fill you and not rapidly increase your blood sugar levels. The other thing, we talk about eating whole grains, seeds, healthy fats. We talk about the other thing, apart from diets, less of processed meals. They said that the more processed a food is, the more unhealthy it is. So we talk about I've mentioned seeds and grains. Then going to physical activity, with the whole remote work from home that COVID-19 exposed us to. Some of us are actually living what we call a sedentary lifestyle, less activity. For you to be actually active a day, you should have covered at least 10,000 steps. That is what experts say. How exercise has been said to the insulin in the body during exercise. It helps it function better. What we say, it increases insulin sensitivity. It makes the insulin work better. Exercise has been linked to that. And this is not specific for diabetes mellitus. Even other chronic health conditions, exercise has an improved physical activity, and that is what we do. We tell you what we call exercise prescription, because we can say exercise. Some people may have some other, we call it comorbidities, other conditions that may not make them easily do some certain exercises.
Okay.
So we have what we call exercise prescription. We tell you the exercise specific for you, specific for your health condition. Other things we talk about, like I had earlier mentioned,
so this is all embedded in the management
lifestyle. Yes, in the lifestyle. Yes, especially in type 2 diabetes mellitus prevention. The other thing we'll talk about is sleep. Poor sleep. Like many of us, maybe we'll go to bed at 10, by 4 we're already awake. I'm sure our mothers can relate to this, but we need to find a way to ensure that we have good sleep, so that our body cells can repair, our body can undergo some healing during the sleep. If it means and then there's something very important. There's something we call sleep hygiene.
Okay.
Things you do around, some people, you want to sleep, you're lying down on your bed, you're still with your cell phone typing, and you're waiting for sleep to come.
Yes.
While waiting, you're still typing, sending messages, checking Facebook notifications. Sleep hygiene, we want to ensure that your room is the lights are put off, including the television, your cell phones away, no coffee around that time.
No cell phones under your pillow.
No, you can put it on your table in your room. Okay, so that's what we call those are one of the things we call sleep hygiene. Very important. This is to ensure that you sleep and you wake up rejuvenated, you wake up strong to face your daily activities. The other thing we were talking about is stress management. The average Nigerian is stressed. Yes, we know.
Yes,
but we need to be intentional. We need to put in the work. Yes, we are facing stress, but what do? Do you say, okay, stress, oh yeah, now I'm facing you, win me? No, because if it wins you, it comes with several health conditions. So you need to manage. What are those things that cause you stress? Why don't you avoid them? Why don't you look for options to ensure that your stress levels are reduced? The truth that stress is on its own is good, though. It helps. Your body has a natural way of responding.
That would be a certain level of stress, right?
Yes.
Okay.
However, when it now begins to overwhelm you, it poses a problem.
Okay.
The body has the ability to there's a normal stress you should face. That's for you to carry out your daily activities. But when it's now overwhelming, it could cause problems for such individuals.
All right.
And then we talk about positive psychology, your mental health, your mind. We talk about social connectedness, feeling happy. Just choose to be happy. The things around you don't seem like it. But when there's a few days ago we learned about mindfulness. Like, even though the things around you are not nice, they are not things you wanted to see, but you just have to find a way
around them.
Yes, and choose to be happy. Smile for no reason, laugh. Be happy for your neighbor. Be happy for the good thing, about good things you're expecting, or even the good ones. Yes, and just be excited. They release some let's say chemicals that kind of make the body cool, calm down. It doesn't make sense. Maybe what I'm saying may not make sense, but these are things that when you do cumulatively, they help you live healthier lives.
Okay. All right, let's open up the phone line. So, listening to Body District on today 95.1 FM, a voice of the people. So, I have Dr. Wala Alechi in the studio, and she's educating us on diabetes. Today is World Diabetes Day, and so we are creating the awareness just so that you can be healthy at all times. All right, so if you've got any questions or contribution, feel free to dial in, send a message in. All right, ask your questions and, of course, your contributions as well. All right, let's take this message. Hi, doctor, please. Differentiate venous insufficiency, leg wound, and diabetes wound.
Leg insufficiency.
Venous
Okay, venous.
insufficiency,
Okay.
leg wound, and diabetes wound.
Leg wound and diabetes wound. Okay. The foot can have wound or ulcers.
Okay.
Wound or ulcers. And there are several causes. Diabetes is just one of them.
Okay.
Diabetes is we can just have a wound because something pierced you or punctured your toes, but you're not diabetic, you don't have any venous issues, you don't have any other condition, and it will just heal. But when there's an ulcer as a result of certain medical conditions, which diabetes is one of them, other things that can cause leg ulcer can include even sickle cell. I don't know if you know about sickle cell disease. Some of them can have such wound ulcers. And then venous insufficiency, like the person mentioned, these are also causes of leg ulcers. So it is when you come to the hospital, we do some investigations, we now find out that, okay, this ulcer is as a result of, the person probably is not diabetic, but it's just that there's some form of venous insufficiency. The way blood flows in the vein is not, there's a backflow, is not appropriate, and so it can cause ulcer. Or the person has diabetes, or the person even tuberculosis can cause a leg ulcer. So there are several causes of leg ulcer. Is to find the cause and treat appropriately.
Hi, good afternoon. Welcome to Body District.
Hello, can you hear me?
Yes, we can hear you.
Okay.
What's your name?
Good afternoon. Yes, my name is Ima.
All right, go on.
Pastor. The doctor was talking about what we eat. I want to find out if eating of too much of bread can cause diabetes.
Bread, you said?
Yes, bread.
Okay, all right. You love bread, right?
Enough bread, yes.
You love bread.
Yes.
Okay, no wonder. All right, Dr. Laruchi, too much of bread.
All right, so the bread he's talking about, thank you for your question, sir. So the bread he's talking about is probably our normal typical bread. Yes, and you find out that I had said that the more processed a food is, the more unhealthy it is, right? So eating bread is processed, and if you can avoid it, avoid it. However, if you must eat it with other healthier variants. You can see people put cucumber, tomatoes, lettuce, padding,
So you can
into
just find a way to arrange your diabetes plates with bread.
So eating it too much will not directly cause diabetes, but you find out that such meals will can make you have weight gain, and then you now start suffering overweight or obesity, which can put you, so indirectly put you at risk. Yes, if you can avoid it, avoid it. There was a time I did a bread challenge, I didn't eat bread for a while. Yes. Wow. So if you can actually avoid it, although it's important to know that people are trying to find healthier options, healthier ways of making bread. So you see some people make bread now and they are not using the typical white flour. So they are trying to find healthier ways of making bread.
Okay, so before we go, we have just about 4 minutes left to do this. The myths and misconceptions about diabetes. I think we talked about one, the urine and the ants. The urine and the ants.
Yes.
too much sugar, can it, maybe that's a risk factor.
Directly it's you would not see or say eating sugar on its own. When we talk of sugar, we're talking of those cubes, right? But you know that those cubes are even processed, so we try to avoid them. On their own,
some
it would
people,
not.
anything sugary,
Diabetes.
yes, exactly.
So the sugary drinks, we try to avoid them. On their own, they will not cause, but they put you at risk. So anything that will put you at risk, you just avoid. You just avoid.
Probably look for.
We talk about no soda. Those soda drinks are sugary, so we say avoid them.
Okay.
Water is the best drink. Take your water and be happy.
Drink water. I like that. Take your water and be happy. Fortune greetings, Sister Faustina. Please, Sister Faustina, tell your guests not to mention bread name again. It's against me. So she wants to stop me from eating bread. From PH. Well, I mean, if it's something that would put you at risk, should you not find a way to avoid it or look for healthier alternatives? Yeah, so maybe you shouldn't totally avoid it, but look for healthier alternatives.
Let me say something about it. When we talk about behavioral change, you can't just, it's unlikely to, you can't just say, okay, you, especially Ebere, hi Ebere, that loves bread so much, you can't just tell her to stop instantly. But you can do something, Ebere, you can start cutting down. It's a step you have started in the right direction. So you can start, if you eat it 3 times a day, you can start doing 101. You're already in the right direction. So you can start cutting down until you finally can avoid it.
Okay. So before we wrap up, let's have your final words on the show, just a few seconds.
Okay, so I want to, those of you that can hear me who are living with diabetes mellitus, I want to encourage you to just be strong for yourself. Adhere to the instructions your health provider has told you. You will be fine if you adhere to them. With time, your medications can even, the dosage, the quantity, they would reduce. Okay? And if you have a family member, as a family physician, that is so much important to me, because we find out that some diseases causes a strain on families. If you have a spouse, a wife, a husband, a daughter,
Sister, brother,
please give them all the support they need. They are going through a lot. Diabetes mellitus, they are going through a lot. So please just give them all the support you can actually render, and together with your support, they can actually fight and win this condition. And the year is about coming to an end. If you know you have not checked your blood sugar level this year, or you have about 6 weeks to the end of this year, please and please again, check your blood sugar levels. Thank you.
Alright, thank you very much. We've got to go now. You've been listening to Body District today, 95.1 FM, and our focus has been diabetes. And I've had Dr. Wala Alochi, Department of Family Medicine, UPTH. Thank you so much, Doc. We appreciate your time on the show.
Thank you.